Yeah, I get it. The doc might want to jump in. I'll just say that we've never said it's only 65 and older. There's evidence, data evidence, that it negatively impacts older and immunodeficient communities, but we've never said it's just older people. Our goal is to make everybody, old and young, across every demographic, understand this is a virus. If you're a human being, the virus can impact you. And even if you're young and healthy and you don't really get much impact from the virus, to be a carrier can be as detrimental to your neighbors and your family members as anything else.
And again, I think that's the importance of emphasizing the social distancing and all the efforts that are being underway to help promote that. Because even what we're seeing is the young people may actually be asymptomatic, but yet they're a carrier, and they're bringing that home to possibly more vulnerable older population. So again, this is a community effort. We need everybody to do their part, continue to hand wash, social distance, and then monitor themselves.
And the governor said yesterday that this area at Duval, we're doing well. Can we talk about, what's your perspective on that? How are we doing when it comes to testing?
I mean, we agree. Just last week, the days are a blur at this point, but within a day of the vice president talking about federally sponsored locations across the country, Jacksonville had been selected. Our local team, led by some of the folks right here, pulled together the people necessary, worked with the state, and across that collaboration, we had this site up and running in a matter of days. And as we're telling you, we actually have additional capacity here, so we've gotten some latitude from the feds to expand the criteria here. I think that's a testament to the fact that all these teams and all these professionals got it going, got it here, and we're ready for a higher volume. Similarly, the city worked with a healthcare partner, Baptist Health, to quickly get a city location. That had another day ahead of this one. So having two operable, well-functioning testing sites is really only one component of a lot of collaborative success we've already had locally. But make no bones about it, it's like we're doing well in the region, but that doesn't necessarily mean we have any right to complacency right now. The guidance is there for a reason. The testing's here for a reason. We need to stay diligent, and hopefully, we can be an example of the rest of the country. But regardless of that, we have to do what we can at the local level.
That being said, do you see any type of reason, or at any point in time, that there may be a stay-at-home order issued in Jacksonville?
I will say that from the mayor's perspective, there is no tool in the toolbox that won't be used if the experts and the science says that's what you need to do. For right now, the guidance that we had throughout the week that's been in place this weekend remains in effect. If it's expanded on, that'll be announced. But if it is expanded upon, it will be done with the best guidance and the best data, so that we don't, essentially there's a spectrum of perfect and fast. If you try to get perfect, you'll never get it done. If you move too fast, you could, hurt people or hurt the economy. So this balance in between is striking that right balance between perfect and fast. The mayor's working on that every day. We don't want to hurt businesses and people's lives unnecessarily, but we need to work with the best data, the best information we have, and the mayor's doing that every day. So every tool is out there and could be used at any time.
One more question.
And when it comes to, we're saying that we could expect more people, more cases to come here. You mentioned earlier how we're working with federal partners when it comes to the equipment and the things that we need here. Talk about, is the shortage of supplies or the test kits, how are we going to deal with that?
Well, we're working every day at the local level and with state and federal partners to increase the inventory that we have in the local area of the protective gear and the testing kits. But we have to balance that with the needs all across the nation and the state. So we work in partnership, but we're constantly working to increase our inventory, and that will continue. At this time, we have the gear and the testing stuff that we need, equipment and not stuff, the testing kits, equipment, the people, and the gear that we need to operate this location and the location at Prime Osborne. and we'll continue to do that as long as we can. And we're working every day to keep the supply chain open.
Can I just ask on a personal level how you guys are all doing? Obviously, you're human. How are you, through all this?
Listen, everybody's got a lot going on. There's a lot of negative impact on business owners, employees, families that have a variety of experiences that this is interfering with. So just like everybody else, I think we're getting through it the best we can and just stay at it.
Thank you, everyone.
Thank you.
Regarding the weather, STEV starts rizzling tomorrow. At what point regarding the weather?
Do you need extra? I can give you some Q&A.
TIAA. Thank you.